Revolutionary AI-guided robot surgeon performs complex surgery autonomously. Imagine a future where surgeries are performed by robots guided entirely by artificial intelligence, without the need for human hands. This groundbreaking development is no longer just science fiction, it's reality. American researchers from prestigious institutions like Johns Hopkins University, Stanford University, and Columbia University have unveiled an autonomous AI-controlled surgical robot capable of executing complex operations independently. But here's where it gets controversial. Could this technology revolutionize the medical field, or does it raise ethical concerns about the role of human surgeons? For over 2 decades, robotic surgical systems have assisted human surgeons, offering precision in cutting, suturing, and probing. However, these systems typically operate under the watchful eye of a doctor. The new AI-guided robot, however, can think, adapt, and carry out surgeries on its own. According to Axel Krieger, a researcher from the Department of Mechanical Engineering at Johns Hopkins University, we were able to perform the surgery with a very high degree of autonomy. What we have done is actually a full-fledged operation. The SRT-H robotic system, powered by AI, successfully removed gallbladders from pig cadavers in 8 separate operations, achieving 100% accuracy without human intervention. This procedure, known as cholecystectomy, is one of the most common minimally invasive surgeries globally, with up to 700,000 performed annually in the United States alone. Surgeons must meticulously locate and manipulate the bile duct and artery to ensure no mistakes occur, which could lead to complications such as bile leakage and tissue damage. The SRT-H system tackled this challenge using a sophisticated approach combining language learning with simulation and 2-layer artificial intelligence. A high-level planner issued commands in plain language, while a low-level controller translated these instructions into precise actions. During each of the 8 operations, the SRT-H flawlessly executed all 17 required stages, including gripping, clipping, cutting, tool changes, and self-corrections. The robotic system was trained on extensive databases, observing over 16,000 demonstration surgeries on porcine gallbladders. Cameras mounted on its wrists and an endoscope atop its head captured detailed images of the surgical process. Unlike previous systems, SRT-H learned from these visual inputs, allowing a high-level instructor to provide feedback later. The robot demonstrated remarkable adaptability, knowing when to request a new clamp or tool change. While the SRT-H performed the surgery with greater accuracy than human surgeons, it did so at a slower pace. Its movements were smoother, and its tool paths were shorter. Despite its impressive capabilities, the SRT-H remains a high-level autonomy system requiring human oversight. Full autonomy would mean conducting entire operations, from initial incision to final wound closure, without human intervention. However, researchers acknowledge that their system is still in the experimental phase, practicing on animal cadavers to avoid the unpredictable elements of live human surgeries, such as bleeding, breathing variations, and camera fogging. More research is needed before transitioning to human patients. Current limitations include bulky cameras incompatible with laparoscopic ports and the necessity for human assistance with tool changes and clip reloading. To enhance safety, the team plans to expand the system's ability to detect potential errors, enabling human surgeons to intervene when necessary. The SRT-H can already be deactivated using voice or touchscreen commands. As this technology continues to evolve, it raises important questions. Will AI-controlled surgical robots replace human surgeons, or will they work alongside them? How will patients feel about being operated on by a robot? These are exciting times in the medical field, and your thoughts matter. Share your opinions in the comments below. AI robot performs gallbladder surgery autonomously, future of surgery. Imagine a world where a robot can perform complex surgery with the precision of a seasoned surgeon, all without human intervention. Sounds like science fiction, right? Well, it's not. It's happening right now, and it's as revolutionary as it gets. But here's where it gets controversial. For the first time ever, an autonomous surgical robot has completed a key phase of gallbladder removal on a lifelike patient. This groundbreaking achievement marks a new era in surgical procedures, where robots can operate independently and adapt in real time to unexpected challenges. Imagine that, a robot that can learn and self-correct, much like a surgical resident guided by a mentor. This remarkable feat was accomplished by a new system named Surgical Robot Transformer Hierarchy, SRT-H. Unlike previous surgical robots, SRT-H wasn't programmed with rigid instructions. Instead, researchers at Johns Hopkins University trained it using hours of real surgery videos. The robot was fed visual data and captions describing each step of the procedure, allowing it to learn the sequence and nuances of gallbladder surgery, including identifying ducts and arteries, placing clips, and making precise cuts. What sets SRT-H apart is its ability to respond to voice commands from the surgical team. For instance, it can understand instructions like, grab the gallbladder head, or move the left arm a bit to the left. This interactive feedback loop enables the robot to learn and self-correct, making it a truly adaptive surgical assistant. During trials, SRT-H demonstrated remarkable adaptability, performing the 17-step gallbladder removal process with 100% accuracy, even when researchers altered its starting position or changed the appearance of tissues using blood-like dyes. The robot's performance matched that of skilled human surgeons, handling unexpected scenarios with composure and precision. The implications of this breakthrough are immense. Traditional surgical robots have made procedures less invasive, but they still rely heavily on human control. The autonomous surgical robot represents a step forward by combining mechanical precision with the ability to adapt and make decisions in real time. This technology could one day lead to fully autonomous surgeries, potentially improving outcomes and expanding access to high-quality surgical care worldwide. So, what does this mean for you? If you've ever faced a long wait for surgery or worried about human error in the operating room, this breakthrough could directly affect your care. Autonomous surgical robots like SRT-H promise faster procedures, fewer complications, and better access, especially in rural or underserved areas. With their ability to learn from real surgeries and adjust in real time, these robots could support overworked surgical teams and help reduce burnout. For patients, that means more consistent outcomes and shorter recovery times. While fully autonomous surgery isn't available in U.S. hospitals just yet, the technology is moving fast. What happened in a research lab today could be part of your next hospital visit sooner than you think. As we stand at the cusp of a new era in surgical medicine, the question arises, if a robot can perform surgery with the skill of a top surgeon, would you trust an AI machine to operate on you or your loved ones? Let's discuss this in the comments. Your thoughts and opinions matter. And this is the part most people miss. The future of surgery is here, and it's more exciting than ever. Autonomous surgical robots are changing the game, combining artificial intelligence, machine learning, and real-time feedback to transform the operating room. As this technology improves, the gap between human skill and robotic precision will continue to shrink. This shift promises a future where surgery is safer and more efficient than ever before. Are you ready for this revolution? Share your thoughts and join the conversation. Your voice is essential as we navigate this groundbreaking change in medical technology. Robotic Copilot, autonomous assistance in laparoscopic surgery. Imagine a future where robots are not just tools, but intelligent partners in the operating room. Recent research reveals that robots, equipped with artificial intelligence, can autonomously assist in laparoscopic surgeries, marking a significant advancement in medical technology. This innovative system has been successfully tested on large animal models, paving the way for the development of automated surgical copilots that could revolutionize how surgeries are performed. The study, published in Science Robotics, highlights the potential of AI-driven surgical robots to perform complex tasks independently, such as picking up gauze and clipping blood vessels during robot-assisted operations. Utilizing an open-source AI simulator, these robots were trained to execute multi-step procedures, demonstrating their versatility across different robotic platforms, including the Da Vinci Research Kit and the Sentai surgical system. Yang Haolong, a PhD student at the Chinese University in Hong Kong, emphasized the transformative potential of surgical robotics, stating, "Surgical robotics holds immense potential for advancement by building upon embodied AI." However, she also raised a critical point: ethical guidelines and regulatory frameworks should be established given that the surgical copilot is emerging at a pace faster than anticipated. This statement invites us to consider the ethical implications of integrating AI into healthcare. As the demand for minimally invasive procedures grows, the autonomy of surgical robots is expected to enhance efficiency significantly. AI-powered solutions could lead to generalized automation across various surgical disciplines, which is a game-changer for the medical field. To realize these ambitious goals, the researchers developed a framework known as VPPV, which includes components like visual pausing, a perceptual regressor, policy learning, and a visual serving controller. This framework allows the robot's movements to be guided by visual cues, making it more responsive and adaptable in real-time surgical environments. The team tested this framework on 7 robotic skill training tasks that align with the Da Vinci skills-based curriculum. These tasks included needle reach, needle pick, gauze retrieval, pick and place, peg transfer, matchboard, and needle regrasp. The system demonstrated robust performance in real-world scenarios, maintaining stability even when the positions and orientations of objects varied. To further assess its practical applications, the researchers conducted ex vivo experiments on animal tissue, focusing on 5 surgical assistive tasks under the Sentia system. These tasks included endoscopic tracking, needle grasping, gauze picking, soft tissue retraction, and blood vessel clipping. The tests, which involved various object types, instruments, and lighting conditions, showcased the method's generalized capabilities. In a final phase, the investigators evaluated the system in vivo using a live porcine model to observe its performance during laparoscopic, robot-assisted surgery. Long reported that 3 tasks, gauze picking, tissue retraction, and vessel clipping, were successfully validated in dynamic surgical environments, underscoring the method's applicability in clinical practice. Looking ahead, Long suggested that the system could be utilized for intelligent skill training, automating complex long-term tasks, and fostering collaboration between humans and intelligent robots. This raises an intriguing question: as we embrace these advancements, how do we balance innovation with ethical considerations in the medical field? What are your thoughts on the future of AI in surgery? Share your opinions in the comments.